So I was a nurse for 25 years, and I get asked a lot. Okay, you used to work in the ER, you used to be a trauma nurse, ICU nurse. Do things really get as crazy as they seem on TV? Yes and no. A lot of times, no. But crazy? Yeah. People ask me, do you have any funny stories when you worked in the ER? Oh, hell yes. There was one night, it was extremely, extremely busy. I mean, just non-stop from start to finish, okay? And it's about 2:30 in the morning. Everybody's already wore out. We still got to make it till 7 in the morning, at least, maybe longer. And I'm taking care of, this very pleasant little old lady who our ER doctor decided definitely needed to be admitted to the hospital, okay? Well, dealing with doctors sometimes, there was this one doctor in particular who was just, how do I even put this? If you're a nurse, you'll understand what I mean, even if you're not a nurse. Okay, if you're not a nurse and you have a boss that is just cannot find it within themselves to be nice to anybody, okay, that is how this doctor was. But he was a specialist and he was very good at what he did, so a lot of people went to him. So I'm taking care of this very sweet little old lady, and I knew we were going to have to call him in. Thankfully, the ER doctor did call him in for me. However, of course, he came in, he's grumpy, he's yelling at everybody. And I'm in the room. I've gotten an IV going on, this gal. And she was in a room that was right across from the nurse's station. Well, this particular doctor was standing at the nurse's station. And he was writing orders. He had told me what kind of IV drip he wanted this gal on, but he did not tell me at what rate, 100 cc's an hour, 150, whatever. So I said to him, Dr. So-and-so, could you please tell me what you would like this IV running at? And I was trying to be as nice as humanly possible at this point, even though I have to admit my patience was short. And to be a good ER nurse, there's also this thing called sarcasm that does actually help. And I actually could probably teach lessons in sarcasm. I have 4 children. 3 out of the 4 of them are sarcasm masters, okay? I could definitely teach this. Plus, I have stepchildren who are also learning the craft. But anyway, when I asked him, what would you like this drip rate at? He turns. Well, actually, he didn't even turn. He just kind of huffed and went, it's right here in the orders. And he started beating his finger on the piece of paper that he was writing the orders on. It's right here in the orders. It's right here in the orders. And sometimes my mouth will work before my brain actually kicks in. And I couldn't stop it. It had already come out. And my response to him was, yeah, and it would just absolutely kill you to just tell me what you want it running at. So this very, very bustling, very busy ER suddenly is dead silent. I mean, dead silent. Because everybody knew this doctor's reputation and how he was. And, and I'm the first to admit, in the back of my mind, I'm going, I just lost my job. I know I did. I just lost my job. And so, one of the main nurses that I worked with all the time, he's looking at me going, hello, not saying anything, but you could see he's going, you're a freaking idiot. What did you just do? Even the ER doctor who happened to be standing by this doctor, who, and this ER doctor I loved working with, excellent doctor, just very, very nice man. He's even looking at me with a look of just, what did you just do? And the only thing I could do, the only thing my brain at this point in time would allow me to do was just very slowly shut the door. So now not only have I probably royally pissed this doctor off, I have now shut the door on him. But the funny part was his own patient, this very sweet, very loving, little kind, little old lady. She is laughing so hard, she even says to me, I'm gonna pee. And all of a sudden, I hear just 2 knocks, hard knocks on the door. And I'm standing there going, and my brain is going, oh crap, oh crap, oh crap, oh crap, oh crap. What do I do? What do I do? What do I do? What do I do? And so the door starts to open slowly. And I don't see him, but I hear him. And all I hear is, I would like that going at 125. Please. And the way he said please was like, you could tell it took every ounce of him to be kind enough to say please. And so as he now is very slowly closing the door, the little old lady, who, mind you, has still been laughing hysterically this whole time, right before the door shuts, she hollers out, asshole, to which I then start chuckling, but I can hear him on the other side of the door still breathing, and I'm like, oh God, I hope he didn't think I just said that. But so sometimes funny things in the ER happen, definitely when you very, very least expect it. Hope maybe this brought a smile to your face. If you're a nurse, I'm sure it probably did. Have a great day.